Hello everyone and welcome to another episode of Ask Dr. Bob. And tonight, last week we talked about men's health and prostate and nighttime urination. A couple important nuggets for you. Men who use soy and a lot of estrogen have a swollen prostate gland. That's going to put pressure on your bladder and cause you to urinate a lot during the nighttime. We use a lot of different products in our practice, but one you can get at a health food store anywhere in the world is calcium D-glucarate. Calcium D-glucarate helps get the extra estrogen out of your body. And ladies could take this too if they have breast tenderness with their menstrual cycle. So gentlemen, urination at nighttime, enlarged prostate. I personally take 12 milligrams of iodine every day. I also take about 3,000 to 4,000 international units of vitamin D in a liquid form. I pass the zinc taste test. I avoid wheat. Wheat and soy deplete the body of zinc. Those items, especially the calcium D-glucarate and the iodine, will help immensely with prostate issues. You don't want to take more than 12 milligrams of iodine at first. A lady contacted me. She's 36 years old and she was diagnosed with emphysema in 2011, and she's concerned because she said that they had a life expectancy of about 4 years. I don't necessarily agree with that. Her concern was a sharp pain, and this is what I want to talk to you about tonight or today or any time that you're watching this, is that if you take a deep breath in and you feel a sharp pain, it's possible that you could have a rib subluxation. A subluxation is when a bone goes out of alignment, and even a rib can roll and causing a sharp pain on breathing. So pay attention to this right now. If you take a deep breath in and you have a sharp stabbing pain, it's more than likely some misalignment in your spine affecting the rib. You want to seek a skilled chiropractor. If you don't have one in your area, come and visit us at CLE. Just go to our website, Drugless Doctors. That's D-R-U-G-L-E-S-S Doctors, DRS.com. And you can find our location. Now what you could do for an emergency situation is roll up a towel a long ways. Cross your arms across your chest. You put the towel behind you and have someone gently just move around. And if you feel a little bit of what we call a release or cavitation, that means the rib has moved. You don't want to force this. I'm not trying to tell you not to seek care. I'm just trying to help you think a little bit. I'm not trying to diagnose you at all, and I don't want you to be diagnosing yourself. But if you have a fever, a low-grade fever, it could be possible pneumonia. If you're spitting up blood, hey, it could be pneumonia. So take this serious, but if you're doing activity, raking leaves or shoveling or doing any type of yard work or even lifting weights, you feel a little pop, could be a rib. Hey, Dr. Bob, what do you recommend for carpal tunnel syndrome? If you have carpal tunnel syndrome on one side, let's say you're left-handed and you have carpal tunnel pain on the left, the preferred side, the side that you use, could be an issue. What's really important is when you come into our office and you have carpal tunnel on both sides, that's usually a neck challenge. Oftentimes after a motor vehicle accident, when your head goes forward and backwards, it puts pressure on sensitive nerves. Carpal tunnel, both wrists, think neck. Carpal tunnel on the preferred side, whether it be your left or your right hand, or depending on what you use, your mouse, could be more of a repetitive strain injury, a preferred hand challenge. B6, we use 150 milligrams of B6 for about 3 months. Oftentimes that alone will help the symptoms of carpal tunnel. Are you familiar with Dr. Joel Wallach? And if so, what's your opinion of his work, health and wellness? You know, I read his work years and years ago. I think he made some very valid points about minerals. We promote Celtic sea salt. We promote a product called multi-mins. Minerals are very important. I want you to know this. This is true. If you eat ice, which we've known this even before Dr. Wallach, it's a sign of an iron issue, an iron need. If you chew your nails, people who chew their nails tend to need minerals. People who eat their boogers even, or eat dirt, their body is starving for minerals, which is a body signal to me that you have underpart or weak adrenal glands. Was wondering what research you've done on alkaline-based diets and the health benefits. You know, I read a book by Dr. Baruti. It's called Alkalize or Die. An excellent book. People who have stress have an acid pH in their body. Acid pH is common in our society today. That's why you want to eat green foods or alkaline foods. Acid causes your bones to deteriorate, osteoporosis. So I thought he made some very valid points. I'm not saying I agree or disagree with the water that he sells. You want minerals, green leafy vegetables, kale, great idea. Last week I was diagnosed with pernicious anemia. Been taking some thyroid meds. What do you suggest? Praying for a healing. Pernicious anemia, this is a very important point for me, this is for all of you out there, is when you have an elevated size of your blood cell, like your MCV and your MCH. That means your mean corpuscular volume. Your cells are very large, but they have poor concentrations of iron, which means you have large blood cells that aren't carrying a lot of oxygen. But I have found women over 40, and men also, but especially women over 40 years old, don't necessarily have enough digestive enzymes to absorb the B12, and I commonly see that most women have a B12 deficiency. Now if you go to our website, druglessdoctor.com, that's all spelled out, DOCTOR.com, we use B12 lozenges from Biotics Research Corporation. Now yours could be so bad that you might need to have B12 shots. So over 40, pernicious anemia, it's not necessarily a low thyroid, it's poor digestion, inadequate digestion. Dr. Bob, you mentioned along one of your Ask Dr. Bob's that aspirin fools the body. We talk about this a lot in the Dr. Bob's Trans Fat Survival Guide. See, if you have your hand in the cookie jar and you're going to have thick, pasty blood, taking an aspirin, yes, will thin the blood, but it also can cause other bleeding disorders, including ulcers, easy stroke. My suggestion to you is, hey, just eliminate all the sugar which is causing inflammation and the trans fat. We don't promote aspirin use. I'm not telling you to stop your aspirin. But we also use essential fatty acid blood spot testing to help determine your fat levels, and that's really important. If we do not use soy or whey, what are we supposed to use? Well, rice protein, egg white protein, and pumpkin protein, and of course legumes and beans, lentils, almonds, any kind of nut. You want to stay away from soy. Soy depletes the body of zinc. It's a natural affinity for aluminum. Young teenage girls that use soy have a greater chance to have estrogen challenges, including tender breasts and cysts on their ovaries. Young boys can have smaller glands, smaller prostate gland, even smaller genitalia. Men who use soy could have what we call man boobs. Okay, you've been great. I thank you for the questions. I thank you for watching us each and every week. Go back and watch some of the old and prior episodes. We have people from all over the world asking us questions. We thoroughly enjoy participating with your life. Send us your questions. Next week, I'm going to give you 3 steps to help prevent allergies, because allergy season is coming. But guess what? I don't have allergies, and if I don't have them, neither do you. Bye!